Hello everyone, my name is陈良. Now let us talk about gas exchange. The first, we also know some principle of gas exchange. Gas diffusion is partial pressure and difference of partial pressure. The main force affect gas diffusion are rate of diffusion, solubility, area of diffusion, distance of diffusion. We also know each gas has a specific solubility. Oxygen solubility is coefficient is a ratio 0.003 ml to 100 ml blood. Carbon dioxide solubility coefficient is a ratio 0.06 ml to 100 ml blood. That is, the solubility of carbon dioxide is 20 times that of oxygen. We assume a premise. Consider a container of fluid in a vacuum that is open to the air. Molecules of gas begin to enter the fluid. After a short time, the number of molecules of entering is equal to leaving. At equilibrium, if the gas phase has a pressure of oxygen equal to millimeter of mercury, the liquid phase also has a pressure of oxygen equal to 100 millimeter of mercury. It is an easy way to talk about gas fluid. Diffusion gradients of respiratory gas at sea level. Attention please. Carbon dioxide is 20 times that of oxygen in blood. That is, carbon dioxide have a relative small diffusion gradient between large amount move into or out of the blood. Gas exchange is affected by two factors. The first is component and partial pressure of respiratory air and alveolar air. The second is oxygen and carbon dioxide in the lung and in the tissue. Now we can see the change of pressure of oxygen and change of pressure of carbon dioxide in blood during gas exchange in lung. In alveolar, pressure of oxygen is 105 millimeter of mercury. Pressure of carbon dioxide is 40 millimeter of mercury. After exchange in lungs, in systematic arteries, pressure of oxygen is 100 millimeter of mercury. Pressure of carbon dioxide is 40 millimeter of mercury. After exchange in tissue or cells, in systematic veins, pressure of oxygen is 40 millimeter of mercury. Pressure of carbon dioxide is 46 millimeter of mercury. In the lung, oxygen and carbon dioxide exchange gas must go through 6 layers of tissue, fluid and suffocated, alveolar epithelium basement membranes, interstitial space, capillary basement membranes, and capillary endothelium. There are 4 factors affecting gas exchange. The first is partial pressure difference in the lung. The partial pressure difference include partial pressure difference and perfusion of the lung blood. Increased alveolar ventilation can increase oxygen partial pressure. Pressure drop of carbon dioxide accelerate gas exchange, and increase pulmonary blood flow accelerate gas exchange. The second is ventilation to perfusion ratio. The normal ratio is 0.84. If the ratio is greater than 0.84, it means that the physical dead cavity has increased, and the ratio is less than 0.84, it means that the functional artery venous starting has increased. And we also know both the increase or decrease of ventilation to perfusion ratio is not conducive to gas interaction. The ratio of ventilation to perfusion ratio is not even. The long autoregulation ventilation to perfusion ratio. When ventilation decreases, the perfusion increases, so the ratio decreases. Then the ratio decrease result pressure oxygen decrease, so long vessel construction of this area. The perfusion decrease, the ratio return to normal. The respiratory membrane's thickness are 6 layers. They are 0.6 micrometer. Pulmonary edema and fibrosis pneumonia can increase the respiratory membrane's thickness. Silicon dioxide silicosis fibrosis also can increase the respiratory membrane's thickness. The total area of respiratory membranes is about 15 to 100 square meter. Lung emphysema, atelectasis, capillary close can decrease the areas. Now we talk about pulmonary diffusing capacity. It is gas volume diffusing through respiratory membranes per minute and per unit pressure. The normal value of oxygen is 20. The carbon dioxide is 400. That's all. Thank you.